Greetings, everyone. Welcome and thank you for joining us tonight's Nurses in the Diaspora panel discussion. My name is Alilia Panis. I'm the director of Cool Arts. This is the first of several exploratory activities that will inform and influence our multidisciplinary dance and media project, Nursing These Wounds. With my collaborators, composer Joshua Ikban, media artist Wilfred Galila, we hope to honor the narratives of Pilipinx nurses in the diaspora. Throughout the webinar, we encourage you to use the chat function to express your appreciation or ask any questions you might have for our panelists. Instructions to access the closed captioning feature are posted in the chat. Lastly, we will be recording this webinar and posting it on our social media, so you may refer back to this session in the future. This project is funded by the ULIT Foundation and the San Francisco Arts Commission. Nurses in the Diaspora panel is presented by Cool Arts in partnership with Filipino American Development Foundation and support from the Bolosan Center of Filipino Studies at UC Davis and Yerba Buena Arts and Events. Here is some information about Cool Arts and the Bolosan Center. I want us to take a moment now to acknowledge the past, the present, and the future stewards of the land Cool Arts is on. We would also like to honor the victims of the Atlanta spa shootings on March 16. The pandemic has tremendously impacted all of our lives. Yeah. All our in-person events have been shut down, but also provided this opportunity to pursue online conversations such as this one tonight. And for that, I am thankful. This event was inspired by the work of Filipino healthcare workers whose experiences with westernized medical education and migrations laid the groundwork for the continuing global export of Filipino labor, shaped the United States medical field, and influenced our community's conceptions of well-being. I was particularly inspired by the book, The Empire of Care, written by one of our panelists, Dr. Ceniza Choy. And I'm so honored to have her here tonight. I'm also super excited for our panel and moderator and looking forward to a meaningful and much needed discussion. Let me introduce our moderator tonight. Let's see, I met Jason Magabo Perez, Jay, this evening's moderator, when he performed The Pasión of El Jovencito in Coulart's 2009 postmodern performance project. I then directed his 2011 hybrid performance theater, You Will Gonna Go Crazy, produced and presented by Coulart's. And as you can see, this is the poster from that event. Jason is a writer, a performer, a teacher, and a scholar. He is the author of Phenomenology, I can't pronounce that one, of superhero. Jason, please forgive me. You need to repronounce that. And This Is for the Mostless. He is a recipient of the NEA Challenge America grant, a recent artist in residency at the Center for Art and Thought, and has been featured performer at the notable venues such as the National Asian American Theater Festival, International Conference of the Philippines, La Jolla Playhouse, and Los Angeles Contemporary Exhibitions. Currently, he works as an assistant professor of ethnic studies at California State University, San Marcos, and is the inaugural Community Arts Fellow at the Bolosan Center. Dr. Jason Magabo Perez.
Good evening. Thank you for the introduction. Hallelujah. My name is Jason. I am zooming in from San Diego, California, occupied, unceded Kumeyaay territory. And so I just want to kind of start off with a bit of a reflection on today's conversation and kind of get us going. I'm really excited and honored to be here. So I want to thank again Hallelujah and the Coulart's team for inviting me to moderate this super important, critical, and ongoing dialogue. I'm the bunso, or the youngest son of Leonora Magabo Perez, one of two Filipina migrant nurses who in 1976 were framed by the FBI for poisoning, murder, and conspiracy at the Ann Arbor VA hospital. Professor Ceniza Choy writes about this in the book that Hallelujah just mentioned, and another case involving Filipina nurses as a sort of widely public and violent signaling of the growing presence of Filipina nurses in the US. I am here in solidarity with my mother in that past and with my mother in this present. Tonight, I want to invite you all to think through the living mess, tendencies, and urgencies of history, of empire, of colonialism, of migration, of the routinized violence of global racial capitalism. Lately, I've been thinking about the living mess, tendencies, and urgencies of history through two separate scenes of my mother walking. One scene occurs on June 16th, 1976, and my mother is walking. She is 31 years old, exhausted from another shift, walking into what would be a long, drawn-out violation in which she would be thoroughly criminalized and harassed by the state. Of course, this is the scene of my mother's arrest, a scene that still replays, I'm sure, in my mother's memory. The other scene occurs on any given day in the present, and my mother is walking her daily walk, She is now 76 years old, and because of the living mess, tendencies, and urgencies of histories, because of the hauntings of racist, misogynistic violence chasing us down, I am terrified for her. I'm terrified for her because these recent waves of anti-Asian patriarchal violence exist along the same continuum and state imaginary of white supremacy and its attending productions of vulnerabilities and precarities of working class Asian diasporic women. None of these happenings are isolated historical events or incidents. Rather, they are endemic of broader structural and historical forces of racism, misogyny, capitalism, and colonialism. What I also invite you to think about or to look for or to seek out is what Professor Nefertiti Tadiar might suggest as remaindered, what gets remaindered or excessed or surplused out of moments like this. What is seemingly lost or slightly out of frame for us to imagine? What love, what practice, what dreams, what visions of liberation are not so easy to notice or be noticed in this wake, in the heaviness of this grief, amidst the whitest of white noise and aggressive white liberalisms? I'm thinking about what it means to grieve, to lose, to care about, to care for, to find each other again and again, and to simply get better at getting better. I'm humbled to be here with our panelists, our communities, our pasts, our presents, and our futures. So we're going to sort of frame the discussion through a really brief, wonderful, short video that was published or posted on AJ Plus or Al Jazeera Plus entitled "Why Are There So Many Filipino Nurses in the U.S.?" And I think we'll use that as a kind of jumping off point and get into some more intimate and focused detail after the video. So the way tonight is going to go, I'm going to kind of introduce all of our wonderful panelists, and they'll sort of also introduce themselves and kind of talk about their interests in relation to our broader topic of nurses, Filipino nurses in the diaspora. And so we'll have them introduce themselves, and then we will also have a conversation with a few guiding questions that the planning team helped me put together, right? And so the first panelist that I would like to introduce is Dr. Catherine Ceniza Choy. So Catherine Ceniza Choy is Professor of Ethnic Studies at UC Berkeley and the author of Empire of Care, Nursing and Migration in Filipino American History. So.
Hi, can you hear me, Jason? Oh, terrific. Well, it's good to see you, Jason, and I want to say hi to everyone in the few minutes that I have with you, and then I'll be joining back later. But I wanted to say how much I love the arts and how dance is one of my favorite art forms, and how honored I am also to be here. I've admired Alleluia's work for some time and Cool Arts. And I'm just so pleased to be with all of you who are attending and fellow panelists. And you just saw a video by AJ Plus, which summarized and highlighted some of the major arguments that I made in my book, Empire of Care. And I just wanted to keep this conversational and informal. I'm often asked why I started researching and writing about Filipino nurses. And I did this for personal as well as professional reasons. I'm the daughter of Filipino immigrants who were not nurses, but I was born and raised in New York City, and the most visible group of the growing Filipino immigrant community there where I grew up was nurses. And when I started to develop a real love and passion for history, I started to realize that in American history, I didn't see Filipino Americans in general, but especially the Filipino women and the nurses who I grew up with in New York City. And I started getting interested intellectually regarding why that was. I wound up getting my PhD in history from UCLA and started researching Empire of Care as part of my dissertation beginning in 1993. And some people have asked me, like, how long did it take for you to write the book, like from the very beginning to the very end? And my response is, it took a decade. I started in 1993 as a graduate student, and the book was finally published in 2003. And that kind of historical research and analysis just it takes a long time. Of course, I was doing other things, both in my personal and professional life as well, but the research involved being here in the United States doing archival research and also doing that work in the Philippines. One of the key elements of my research was conducting 43 in-depth oral interviews with Filipino immigrant nurses, primarily in New York City, which also has a very large percentage of Filipino registered nurses in New York City hospitals. And I feel this is very much a community collective effort, and I'm very grateful to those nurses for sharing their stories with me when I was a graduate student, and just letting me listen, to their lives, their struggles, their contributions, and out of that archival and also ethnographic research in the U.S. And in the Philippines. Um, I was able to put together how this migration is a very long history. And at this point in 2021, we now have multiple generations or cohorts of Filipino nurse migrants and US born Filipino American nurses, because I mean, Filipino nurses, their mass migration started in the 1960s, 6 decades ago. People ask me what I'm doing today about Filipino nurses since the book came out in 2003. And, it's been, as Jason was saying, since the pandemic in March 2020, this has been really a devastating time filled with grief. And National Nurses United published a study in September of 2020 pointing out that even though Filipino RNs comprise only 4% of the registered nurse workforce in the United States, they've comprised 31.5% of the RN deaths as a result of COVID. This is a disproportionate and devastating toll. So one of the things I've tried to do since the publication of the book and during this pandemic was to do media advocacy for Filipino nurses, to work with the media to make sure that there was attention to not solely their deaths, but also their longer history and their contributions to US healthcare delivery. And I feel that my efforts this past year have again been a collective effort. I want to acknowledge various groups I have intersected with, including the Filipinx COVID-19 resource and response team led by Dr. Nines Ponce, the Philippine Nurses Association of America Heal Our Nurses campaign, Kanlungan.net, which was founded by the transnational feminist organization Affirm, and its digital memorial and data wall for all the fallen Filipino health workers, not solely nurses, but health workers around the world, the United States, as well as so many countries throughout the world. TIO Help Desk has been a great resource for myself personally, as well as my family and the broader community, to inform the Filipino American community about COVID-19. And finally, I want to say thank you to the co-president of National Nurses United, a Filipino American, Zany Cortez, for her critical leadership during this very difficult time. I'm still grieving about the shootings in Atlanta, and I've recently been doing more media advocacy to emphasize how racism and misogyny intersect in Asian American history and American culture more broadly. And just to conclude, Jason had mentioned our connection with my research and his mother, a Filipino American nurse, Leonora Perez. And in that chapter where I talk about US versus Narciso Perez, I also talk about what has now been referred to as the Richard Speck Massacre, in which two Filipino exchange nurses were tragically murdered in 1966 in Chicago. But the lone survivor of that massacre was also a Filipino exchange nurse who used her wits and will to survive and then to testify against Richard Speck. And I've been inspired by the bravery and sacrifices of Filipino nurses throughout this long history to continue to do the research, writing, and media advocacy work that I do today. So thank you for inviting me.
Thank you, Kathy. We look forward to the conversation after the introductions. Thank you for joining us tonight. So our next panelist is Haniely Pableo. Haniely or Han Han Pableo is a surgery nurse at Toronto General Hospital and is part of the Emergency Response Intubation Team, or ERIT, and is also a rapper and a musician.
Oh, hello, everyone. Thank you, Jason, for that lovely introduction. So thank you, Cool Arts, for having me. My name is Haniely Pableo, and I'm zooming in from Toronto, Canada. I'm an artist, and I'm also a nurse. I was born and raised in the Philippines, and I'm here to sort of share my experience and how I became a nurse in Canada. So both of my parents were OFWs. They were both overseas Filipino workers. My dad was a truck driver in Saudi Arabia, and my mom was a domestic worker in Kuwait. And then she went to Hong Kong, and then she came to Canada through the Live-in Caregiver program. And the reason why I'm in Canada is because she sponsored me and my sisters to reunite with her way back in 2006. So I was already in my 20s when I came to Canada. And I was already a graduate of nursing in the Philippines, a fresh grad, and also a newly licensed nurse in the Philippines. But I didn't have any experience working in the Philippines as a nurse other than my student nursing experience in school. So when, sorry, I don't know how to, okay, sorry. In my family, I am actually the only nurse in the family. And I'm also, my sister and I are also the only college graduates in my family. So I'm pretty much the pioneer. I grew up in a rural part of northern Cebu, and then moved to the city to study high school and nursing eventually. My grandmother was the one who raised me, just like any other dependents of overseas Filipino workers. Nursing was not actually my first choice. I was a salutatorian in high school, and everyone expected me to take up accountancy. But secretly, I wanted to be a chef. But then my mom suggested I take up nursing, And at 16 years old, I didn't really know what I wanted to do. So I just said, okay. So that's how I ended up taking up nursing. And one of my best friends was also taking up nursing. So it kind of influenced me to take the nursing as well. Then when I came to Canada, uh, I wasn't a nurse directly because the education system in the Philippines is American based, and the educational system in Canada is British based. So I'm missing 2 years of university that I have to make up for. So when I had my credentials assessed, I was told by the regulating body in Ontario that I had to go back to school to get my degree. But then I can work as an RPN, which is equivalent to LPN in the US. I'm not sure. And I could have worked as an RPN, but I know that I can do more, and I know that I'm capable of being an RN. So I decided to go back to university, and being a new immigrant to the country and already economically disadvantaged. So it was kind of hard. I had to work 2 jobs to go to full-time school. But then I made it. And also it was also during that time when I became active in the community. I started volunteering in a Philippine Center for the Arts, Kapisanan Philippine Center for the Arts, and I also participated in community organizing. I was one of the first members of Migrante Ontario, which is now Anak Bayan Toronto, and they advocate for social issues that the Filipino Canadian community in Toronto are facing, most especially geared towards migrant workers, and that is close to my heart because I am a migrant worker and my parents are both migrant workers. And in Canada years ago, the citizenship and Immigration Canada does not include nursing as part of the point system for migration. So a lot of the Filipino nurses came here through the live-in caregiver program, and then when they finish their working visa, which is 2 years, they can apply for a permanent residence, and then they transition into becoming a nurse, where they go back to school, take up this bridging program, and then go back to university for 2 years, and then take the exam, the Canadian exam, which is different from the American exam. And it was frustrating for me at first. I even took up the NCLEX because I thought maybe I should just go to the US. So I actually took the NCLEX. I passed. All I have to do is transfer to the US. But I decided that I'll just stay in Canada and just go through it all, and I did. And I've learned a lot, and that's why I'm here right now. And um, it's my story is sort of like uh, typical of immigrants, that you're being deprofessionalized. In Canada, there's a lot of professionals coming from other countries, not just the Philippines, who come here and literally start from zero. So I wouldn't say my story is exceptional, because every immigrant experiences the same thing. And when I graduated university here, I moved to another city because I have to pay my student loan, and so because the living expenses in that city was less than Toronto. And then after 3 years, I quit my job in nursing, and then went back to the Philippines for 6 months to travel and to also volunteer in Leyte. It was after Typhoon Haiyan. Like, I raised funds, I donated money, but I felt like it wasn't enough, so I wanted to be there, and so I went there as a volunteer. And pretty much it was community health, but really I was like a free laborer, and we built houses and ships for the community in Leyte. And then after that, I came back to Toronto and traveled again, and then went to Australia, did my working holiday visa, and worked there as an agency nurse. And then I came back to Toronto because I got offered a job here in Toronto General, and that's why I'm here now. I work in operating room, I work in cardiac surgery, and during the pandemic, I am part of the emergency response intubation team, which is the team who takes care of the respiratory management of COVID unknown or COVID positive patients. So I'm literally in the front line. And if you can see the pictures, these are actually our rehearsals and how to put PPE. I wasn't wearing an N95 because we didn't want to waste our N95. We had issues in N95 shortages, and we kind of run the drill and that's why I'm here now, and that's it.
Thank you, Han Han. Thank you for sharing a little bit about yourself and your experience, Han Han. I'm looking forward to hearing more of your experiences. The next panelist I'm going to introduce is Ritchel Gazo, who's a Bay Area Kaiser pediatric nurse and executive director of Parangal Dance Company.
Hi, can you guys all hear me and see me? Wonderful. Thank you, Jason, and thank you, Cool Arts and Manai, for inviting me here today. I will share a little bit of my story and my background. And I was actually born in Ibahay, Oakland in the Philippines. I immigrated to the US when I was still young at the age of 6, and pretty much have lived in the San Francisco Bay Area. I grew up and went to school here all in San Francisco. I am actually the youngest of 8 kids. So I too am also the bunso like Jason, but I am the youngest of 8. I consider myself as one of the people who made it to the US and have been able to live that American dream. I was never actually pressured to become a nurse. I think the only real pressure for me as an immigrant was to make a good future for myself and make my family proud, and just avail myself to any and all possibilities to live that better life in the States. I've actually always wanted to become a nurse since I was a little girl. I love taking care of all my baby nieces and nephews. I always pretended like they were my babies. So I've always knew I wanted to work in pediatrics. I am actually the first nurse in my immediate family, and I am the first to earn a master's degree. So long story short, I was trying to get my nursing prerequisites. And the timing was just right for me because by the time I had graduated nursing school, nurses were really in high demand. The nursing schools were still impacted, but not as impacted as today. So as I graduated, I was actually able to immediately work in the department and the unit that I wanted, which was in the NICU, which was kind of my niche. That's the path that I've always kind of wanted to go into. Which, you know, right now, today, it's so hard to, 1, even get into nursing school, and then 2, to even get into the department that you'd want to do. So for me, I think I was just in that right, perfect timing. So I got my bachelor's degree from San Francisco State, and then I got my master's degree in nursing from UCSF as a clinical nurse specialist in neonatology. And I've been working now as a nurse for 16 years. So 11 of those years, I have been working as a neonatal intensive care nurse. And now I am currently as a pediatric home health nurse. And I guess you can say that, you know, within the nursing career, it brings you to different and many opportunities. So I worked in the intensive care setting with premature infants, and I'd love that. I thought that was kind of like my niche that I would never leave, because all those NICU nurses would never leave that department. So it's really hard to get in there. But life happens, and I kind of went in and out of like maternity, labor and delivery, you know, and then newborns. And then when my father passed for cancer, he was in hospice, and that brought me into the other path of hospice nursing. And it kind of opened those doors for me. And I was actually very impressed and honored, and I was really just inspired by them for that path. And so my career path, along with my personal path, kind of took a turn, and I got out of the NICU and I did some hospice advice, started doing some adults as well. And so now currently, life happens again, takes its turns and challenges. And so now I'm in the community doing home health nursing with pediatrics. Which is now I could kind of combine both my NICU background and being in the home setting. And I love the teaching aspects. I do a lot of teaching. So that's kind of where I am currently. And so on a personal level, I am also a mother of 2 boys. They're 12 and 10. They are very energetic, but it's great. I love also being a mother. I also have been a long time Filipino folk dancer. I started doing Filipino folk dance since high school, and I've been dancing for over 25 years and still continuing to. So it keeps me in good shape. And it's also what keeps me, a balanced life. So for today, I think what my experiences are like, I would be sharing is kind of how I try to manage that all. But it's kind of what I have been doing. I am currently the executive director of Parangal Dance Company. And so I try to bring that Filipino culture side of me to continue with that and to promote it, and to stay, connected. And so that's a little snippet about myself, and I hope to continue to answer some more questions later on today. Thank you.
Thank you, Ritchel, for that snippet. I'm looking forward to your hearing more of your experience in the conversation. Our next panelist is David Monkawa, is a labor organizer and the former assistant national organizing director for California Nurses Association, CNA, NNU AFL-CIO. So.
Hi, thanks so much for allowing me to say something about nurses and Filipino nurses in particular. I don't have a lot to say about my own life. I think I'm here to talk about what the nurses did because it kind of impressed me. I think in the early 2000s, I was a lead organizer for the California Nurses Association, and I began organizing in downtown Los Angeles at Good Samaritan Hospital. I did not realize at the time that the majority of nurses at Good Sam were Filipino, led by a charismatic leader named Suzette McCorda. Only a few months before, the union, CNA, which only had very few hospitals that were union in Los Angeles, they won St. Vincent's Medical Center with about 400 nurses. I would say 95% Filipino. And now we were working on Good Samaritan. And Filipino nurses in all the hospitals that we went to in the early 2000s, and we organized probably 30 to 40 hospitals in California. These are hospitals that were not union before, and the bosses, the management would put up a very, very stern, vicious fight to stop it from being union. So they would harass nurses, they would intimidate them, and there are all kinds of professional union busters who would come and try to engage in all kinds of tricks to try to deceive nurses into voting against the union. So it's very, very tough days back then. But luckily, with the nurses being very strong, they're very good with organization, multitasking, and things of that sort. And at that time, many were veterans of the anti-Marcos movement. Still, many of them were in their 40s and 50s, but they're still working. And they provided a real good, solid background and context, political context to why nurses, all nurses, but in particular Filipino and other people of color nurses, should unionize and try to fight for their democratic rights on the job. So they were kind of like the OGs at the time. And so this movement of organizing nurses took off. And the reason for this is because at the time, there was horrible staffing ratios. In other words, there'll be one nurse and 5 or 6 patients in certain units where there should only been 3 or even 2, which is intensive care unit. And so that was being violated. So the union as a whole was trying to pass a law that would make the staffing ratios mandatory and fair and safe, most importantly, across California. And California was the only state in the union that would even come close to having even a law like that at that moment because of the activism of the nurses. So after downtown Los Angeles, the South Bay area where the refineries are located was sort of another area where several hospitals, Long Beach Memorial, St. Mary's Medical Center, Little Company of Mary Torrance in San Pedro, and another small hospital, probably about 2,500 nurses. I would say the majority Filipino in many of those areas. They all organized unions. And what happened was that many, many young people at that time were coming in due to respiratory problems and other kinds of ailments that they were picking up from the refineries and the port of Long Beach and port of Los Angeles, because there were like many, many freight and railways and trucks that were polluting the area. And when they started to activate for better patient care and something to be done and looked into about these premature young people coming in with respiratory illnesses, the administration pushed back. And, half the board of the administration, I don't know if it was half, but there are many powerful oil companies that donate to Long Beach Memorial Hospital. So they did not want tales of children with polluted lungs from oil refineries to be exposed to the media. So it was quite a struggle. And, again, Filipino nurses played a leading role in fighting for those kinds of things to be addressed. And a little bit later on, they came up, they played a big role in coming up with the idea of single-payer healthcare, or Medicare for all, which recently had 112 sponsors in Congress and was introduced by Representative Pramila Jayapal. But this was 2021 when this happened. But the idea and the seeds for Medicare for all and single payer had their roots back in California, in the refinery areas in Wilmington and Long Beach, and also in Richmond, California, where nurses there also started to discover the same types of social ills coming from industrial pollution. So in my opinion, I feel very fortunate and very, very honored to have been able to work with so many of my comrades. And, we fought in against management, against all kinds of different forces, the fossil fuel companies, and all sorts of things. It's still going on. To this day, just recently, not to this day, but last year during the pandemic, on 3 different occasions, Kaiser Sunset nurses with CNA called on our organization, Progressive Asian Network for Action. I'm with a group called PANA. And we went out there to support them in their struggle for adequate PPEs. They weren't getting the PPEs. And they had 3 different actions. They weren't strikes, but they were physical actions in front of the building, not letting certain things go through, or allowing people to go through and function, but very slowly by clogging up the driveways. So we had those kinds of actions, and they actually won it. They won in after the 3rd action in July, I believe, and they did get their PPEs. So within Los Angeles, the Kaiser nurses and the Providence St. Joseph nurses in Santa Monica led all nurses and all healthcare workers in fighting for PPE. So I was very proud of that. And again, Filipino nurses distinguished themselves in that fight as well. Are there, I'm looking, do you want me to continue? Hello?
Hey, David, we'll get through the introductions. Thank you for sharing that.
Sure.
I think there'll be some opportunity for you to
Sure.
elaborate on some of that. So thank you
Okay.
for joining us today and for sharing.
No problem.
Thanks again. again, David. I'm going to introduce our last panelist before we get into conversation. Our last panelist is Dr. Claire Valderama-Wallace. Claire Valderama-Wallace is assistant professor in the Department of Nursing at California State University, East Bay, and is the current chairperson of GABRIELA, Oakland.
Great. Thank you so much. Can y'all hear me okay? We're good? Okay. So thank you so much. First, thanks to Jason and to the entire Cool Arts team. I think spaces to gather and have conversation are just so important, more and more. So I have some photos to show. So really, I come here thinking about so much. I think about how there's so much for us to uproot and to reimagine. And I really wanted to take a moment to uplift examples of nursing students who are now nurses in community, raising their voices and serving the people, because I think that is vital. That is nursing to me. And ultimately, with every year that goes by, I find that my work in nursing education, as a parent, as a partner, as a nurse, more and more is really a fight to name, resist, and dismantle white supremacy and colonialism. And being Filipino is central to how I view the world and my work and my role in all of these spaces. And I really have to say that nursing institutions actively invest in colonialism. So I think day to day, year to year, about how Filipino women in particular navigate all sorts of silos, silence, and silencing. If you can go to the next slide, please. So we in GABRIELA, Oakland have stood in solidarity with nurses, with unions, and this is one of the multiple examples. This is from One Folks Went on Strike in October here in the Bay Area. And just as kasamas and comrades are finishing outlining this beautiful mural designed by one of my comrades, I went to the mic and I led folks in a chant and said, hey, y'all, come join us. Join us in painting this mural, because this is one example of the manifestation of your vision, public health in public hands. And as soon as I got off the mic, two folks came up to me. I was like, I don't know if I recognize who they are, because all of us are masked up. And it turns out they're two former students. And I found myself so proud to stand there with them and to know they're being brave and using their voices and joining their fellow nurses. But I also felt surprised. And I realized later, I was asking myself, do we in nursing education and in our families ask each other to recognize our courage and to trust our voices, right? As Filipinos, we have resisted colonization for centuries and we continue to. And so I feel like it's really a core part of my role as a nurse educator to connect nursing students with movements, to see these shared struggles. How are Filipino nurses, seafarers, and teachers, domestic workers connected? How are we connected to the ongoing mobilizations of Amazon workers, right? Missing and murdered Indigenous women. So what are our connections, right? And colonialism asks us to see these as separate and isolated, but we know they're connected, and just as we are all connected, right? And the final slide, please. So when nurse Don Wooten blew the whistle about forced sterilizations at a detention facility, some nursing students reached out to me and said, what can we do? We need to take a stand and do something. And just, less than 2 weeks later, we had this beautiful vigil and we honored Breonna Taylor. We honored migrant women. We honored Lucy, Betsy, and Anarcha, the mothers of gynecology who were enslaved. And so that's just a lot. I'm just going to say there's a lot on my mind and in my heart. And I'm just so thankful to everyone for joining us tonight and being here.
Thank you, Claire. I love this phrase, recognizing our courage. I appreciate the work that you do, and I'm excited again for all of the panelists to be in conversation, Kathy, Haniely, Ritchel, David, and Claire. And so I want to maybe we're going to transition into the conversation, just as a sort of announcement. Nurses in the Diaspora is presented by Cool Arts, as you know, with support from the Filipino American Development Foundation and Yerba Buena Gardens Festival, and funding support from Hewlett 50 and San Francisco Arts Commission. All right. So we have a few points of discussion across the panelists, and so um, I want to just start that off. It'll sort of be uh, um, an informal kind of riff off of a few prompts. And so the first question that I do want to ask is directed to Kathy, David, and Claire. And so I can talk about, in order, just so that it's a little bit, we have some scaffolding for our viewers and our listeners. But I want to invite you to talk about your, as you already have kind of done already, and maybe this is a time to elaborate. I want to invite you to talk about your personal and political perspectives on and experiences in labor and or broader community organizing for and with nurses. What have been the core issues and struggles specifically for Filipino nurses over the years? And so maybe we might start with Kathy, and maybe you could kind of talk about some of the historical context that you've come across, some of the historical struggles that you've come across as you were studying the trajectory of Filipino nurses migration. And then David, perhaps you can elaborate a little bit more on some of the issues and some of the struggles that you witness nurses fighting for or advocating for in your experience in organizing, and then Claire perhaps elaborating on some of that solidarity work and some of the contemporary activist stuff that you're bringing together in the East Bay and broader. So Kathy, feel free to.
Yeah, I'll go ahead and start, but can I just say how much I appreciated everyone's presentations? I just found it so moving and really inspiring. But to answer your question, Jason, about some of the major struggles that I was researching when I wrote Empire of Care, these struggles included from like the early 20th century, some of the racial and gendered hierarchies that came out of the history of US colonialism in the Philippines. And that even though young Filipino women were being targeted for nursing education, and even though the idea was that they could become nurses, there was a hierarchy, a racial gendered hierarchy there, in the sense that they could only become like professional nurses under American tutelage, American white women's training. So there's that issue. And then in the second half of the 20th century, when we started to see this mass migration of Filipino nurses to the United States to alleviate critical nursing shortages, there were so many challenges. Some of the, I guess, more mundane day-to-day ones, but that I think are still important, which I learned from listening to the oral interviews, were things like loneliness and homesickness. And especially for that generation of Filipino immigrant nurse pioneers, in the 1960s and early 1970s, sometimes being like, just a few at that point, and having to like deal with the cold weather and adjusting to that, adjusting to different American accents, sort of the colloquial English, language. And, sometimes when we would talk about it during interviews, it was kind of humorous, but it's also that feeling of like being, out of your element and having to adjust. And I have a lot of respect for Filipino nurses who not only overcame that to adjust here, but then also organized themselves in things like local Philippine Nurses Associations in New York, or, in parts of Texas and Florida, in order to provide welcome and comfort to the next generation, Filipino migrants. But some of the other struggles were pretty deep, and in the sense of things like fraudulent recruitment practices, workplace discrimination, racial scapegoating in the case of US versus Narciso and Perez, and pressure to speak English only in the hospital, even during like work breaks or just personal phone calls. So there were a lot of things going on, and I guess one of the things that I learned from doing the research in Empire of Care is how at these various like moments over those 6 decades from the 1960s to the present, there have always been actually at several points like Filipino nurse activism that's really pushed back against this scapegoating and discrimination, harassment. And it's a formidable history.
Right. It's interesting, right, Kathy? Like the issues that you bring up in terms of like the struggle of establishing like a community, right, and kind of battling against like loneliness and kind of things like this. That this sort of context of like melancholia, and just kind of some of those issues kind of being sites where nurses gather and organize, right, and create community, right. And I think it's interesting to kind of hear both kind of what David might add to that in terms of some of these very issues that their nurses are advocating for themselves, and of course Claire. So thank you for that, Kathy. David?
Well, I would say that within the union there was a disparity between Filipino nurses and white nurses and what they made, but that was never a popular thing to try to discover and put out into the air. I thought it would be, but higher ups did not. But anyway, I did so anyway in certain areas. But I want to describe to you how a hospital. It's the first private hospital in the history of Texas. There's never been a union hospital in Texas ever in its history, 300-year history. But with the help of Filipino nurses, Suzette Nacorda and others, were able to organize a hospital called Cypress Fairbanks Medical Center in North Houston. And it's the first ever private hospital. The first time that we went there to Houston, and we got calls from nurses in Houston. People call us from all over the nation. Hey, come help us here, come help us there. So when we went to Houston, we were in front of the hospital in the driveway leafleting. And for some reason, it started snowing in Texas. This is one of the first times ever. And it was really cold. And then this white woman came out. She was a nurse. We didn't know she was, but she says, do you speak that tag-along shit? And then we're looking at each other going, what are you talking about? She says, tag-along. And so Suzette says, you're talking about Tagalog, aren't you? And she goes, yeah, tag-along, So then, we said, well, we speak it and blah, blah, blah. So she says, you with the union. If I see you on the driveway, I'm going to run you over. I want you to know that. And so we said, oh, okay. And so that was our first introduction to Texas, Cypress Fairbanks Medical Center. And, so wherever you drive around, you have to go with a couple of people, those kind of situations. This is, way back, but 10, 15 years ago, but, it was still like that. And as people know, everywhere you go in Texas, if you go to a hospital, there's a big sign in the front door that says, leave your guns outside. Don't take guns into hospitals in Texas if you don't know no better. So anyway, that was the kind of environment that some of the nurses functioned in. But, people are very resilient. Suzette's attitude was, well, hey, bring it on, And we just, we were there. I think we were there for a better part of a year. And, there's lots of battles face-to-face with management and with some anti-union hostile white workers and stuff. But we prevailed. And, I just thought that the things that people went through already, the nurses are already pretty tough anyway, because they went through a lot, back home, and they went through a lot here. So a lot of the things that they saw and went through was not that big of a deal to them. I was kind of surprised about that.
Thank you, David. Yeah, that's part of that moment in my introduction about this kind of these terrifying moments, right? And I think it's you know a lot of kind of what we're seeing in terms of what Kathy brought up in terms of these sort of daily violences against Asian, particularly working class Asian diasporic women, right? I think that that kind of intersection of anti-labor, right, and misogyny, racism, colonialism, right, all kind of impacting and being laid bare, especially in a very, very vulnerable moment like right now, right, during the pandemic. So thank you for sharing that.
Can I just say one thing?
Sure.
One
Yeah.
thing? Yeah. The a lot of these cases of anti-Asian violence, they wouldn't happen so much if corporate anti-Asian violence was not behind it. By that, I mean this whole thing from Trump about the Wuhan virus. Well, that was preceded by Obama and others who said that the Chinese were like pirating state secrets, taking technological secrets. There are also, like human rights violations against the Uyghurs and many other things, right? So it was not like the first time. I mean, Trump's racism is bad and everybody knows it, but it wasn't the first time. And even after Trump, now we have, Biden made a statement against anti-Asian violence, but the very next day, the Secretary of State said that China is one of the biggest challenges in the whole world as far as the U.S. is concerned. So, there's mixed messages coming out. But if all that wasn't going on, I present to you, I don't think that the anti-Asian violence would be as bad, correct? So there's a lot of state-sponsored and corporate violence because all those attitudes came from the 5G, robotics, and AI people who are far behind China, and they feel it's an existential threat. So they make up all these excuses to go attack China. And I'm not saying China's great or anything. They encroach upon the Philippines and certain islands, but nevertheless, compared to the U.S.'s 800 military bases, they're not quite as that. So I think that in the past, same thing. Vincent Chin or Japanese Americans thrown into camps. These are all either corporate or state-sponsored. Thank you.
Thank you for that perspective, David. Claire, I want to invite you to maybe also offer some reflections with your experiences.
Thinking about personal and political histories, I have to start with my mom. She came here in 1970 as a chemist, and then she became a nurse when I was 4. So I actually remember being at her pinning ceremony and seeing everyone in their white caps, their white dresses, and so when I stand with Gabriela Oakland, when I stand in solidarity with workers and Filipino nurses in particular, I'm standing for my mom, right? I'm standing for nursing students who I am trying to support and I bear witness to their brilliance every day. But I also know that they're going into this institution and this profession that isn't necessarily going to care for them the way that they deserve. So for me as a nurse, an educator, a researcher, an organizer, none of these were goals I had for myself when I was a kid. It was really, you need to be a physician. But I've been a nurse now for 13 years. I've been an educator for 10, and I've found my political home with Gabriela Oakland, and I will forever be grateful. And all of this work has showed me the power of collective action, including in unions like my own, California Faculty Association. But I see how people in positions of power try to silence or dismiss, or worse, union leaders and truth tellers. And we see widespread attacks against human rights defenders, union leaders here in the Philippines, around the world. So when we talk about colonialism, these tentacles are just reached so far and deep, and even into the goals and dreams that we have for ourselves. So when the pandemic really started to unfold, in March, I reached out to folks I knew at CNA, and I said, how can I help? What can I do? What can Gab Oakland do? And so we mobilized folks from multiple Filipino grassroots orgs like Anak Bayan, Malaya Movement, Bayan, Philippine Solidarity Task Force. And we work with nurses, we work with union members, and we mobilized for vigils, for rallies, and at Alameda Hospital, where I volunteered in high school, one of the hospitals my mom worked, Highland Hospital and San Leandro Hospital. And some of the nurses we work with are actually former nursing students of mine. And we uplifted healthcare workers' calls, right? for us, the analysis, core to our analysis is that this disregard for Filipino nurses is so tied to similar conditions across industries, right? Including seafarers, domestic work, et cetera. And it's all tied to this ongoing divestment from public health, from, safety net, from housing, and we have increased militarization throughout the world, and those are so tied together. I think that that's something that is really core to our work and to my lens as well. I do want to call out that it's really important for us to think about frontlines is just wrapping throughout our families and around the world and across generations, right? In a given Filipino family, you can have a nursing student, a respiratory therapist, multiple nurses, CNAs, physicians here in the Bay, other parts of this country, in Canada, in Europe, in the Middle East, in the Philippines. And so, these front lines wrap us, right? And something else I want to call out, in closing is the fact that, thinking about Filipino nursing students, right? When you look at the data around nursing students enrolled in baccalaureate programs here in California, the highest attrition rates, right? The nursing students most likely to leave are Black or African-American, Latinx, and Filipino. And these are patterns that I think echo for us in multiple ways. So I think uprooting racism from nursing education is one piece of all of this anti-colonial effort that's going on.
Thank you. Thank you for sharing that, Claire. So there's some side conversation that we might bring up. So I'm going to kind of get through some of this, kind of bring the questions and the prompts on first, and then we'll come back to the Q&A. So for folks listening in, if you're have questions for the Q&A, please send them in, and we'll hopefully have some time to work through them towards the end here. So I want to move to the next question. I want to bring back on Han Han and Ritchel. So I'll great. So we've talked about it. Alleluia talked about it. Kathy talked about it. David talked about it. Claire talked about it. You all talked about it. So we've seen the disproportionate impact that the pandemic has had on Filipino nurses in particular. I remember myself at the beginning of the pandemic, my sister-in-law, who's an ER nurse down here in San Diego, texting us for really kind of urgently texting us for additional masks and other forms of PPE right at that beginning moment, stuff that we might have lying around. So as we've seen the crisis unfold, we've lost, and I think Kathy brought up the Colungan Project that documents this loss. We've lost countless Filipino nurses and healthcare workers across the globe. And so I want to know, and I think you might have started to gesture at this a little bit in your introductions. What have been your experiences in managing such workplace vulnerabilities, and or what other stories would you like to share about your experience as a nurse during this moment? And maybe we'll start with Ritchel. Perhaps you can share some reflections on your experiences as a home health pediatric nurse, and then we'll invite Han Han on here after that.
Yes, sure. So Han Han, I think, will really touch base more on the front line, as she is definitely in that front line. I am more in the community-based, but I think what I'd like to share really from my experience is more of how this whole COVID pandemic has affected me as a nurse and as a Filipino nurse. And so, first of all, my heart goes out to all the tragic deaths of all the nurses that's had to be at that front line and has passed, because it's just heartbreaking. I'm maybe the first in our family to be a nurse, but I do have sister-in-laws that are nurses. I have a lot of my other family members in the medical field. My cousin in Florida is a nurse practitioner. So I'm always, very worried whenever anybody is in that healthcare setting, because we're all exposed to that. And during this pandemic, it's been very challenging and very difficult time. So personally for me, I think that, nurses really do take their work to heart. We're very serious about what we do. We love what we do. I would say, 95% of all the nurses, especially the Filipino nurses I've met, we love what we do. We think of it as a calling. there's a few out there that I think some of the younger nurses go in for the wrong reasons because they think it's more for money. But like I said in my intro, I was never pressured as a nurse. So I have a calling for me. And so I think when, as a nurse in general, you put your heart into everything. And you are expected also to be on your A game. You have to just kind of always put aside everything that's, on that personal level, and you come to work. You're that frontline soldier, wherever it be, whether you're at the ER, you're in the NICU, you're in the ICU, you're at home in community public health. You have to be on your A game. And, you go through so many challenges. And for me personally, in pediatrics, I may not get a lot of COVID pandemic situations, but in general, as just a pediatric nurse, I also deal with oncology pediatric patients. I dealt with hospice patients. And so it takes a toll on you. And I feel like sometimes you are this type of like boiling pot where you can't a pressure pot cooker, where you can't allow yourself to let it all out. You just have to maintain it because you have to act and show that you're still strong and you're out there advocating for your patients. So we put up a really good image in front of everybody that we're okay, but in all honesty, we aren't, right? And you have to go back to the same thing. I know I'm just smiling because we both understand each other. And I think a lot of nurses out there understand how we just kind of have to keep pushing ourselves day to day. And I think a lot of the things that I can relate to is that you have a lot of nursing colleagues that share that same experience, and that is a community that we have. And it's an awesome thing because it's a family. And, you may have a partner, you may have your husband, you may have your wife that can understand what you're going through. You may have friends, but another nurse that really knows what you're going through is just different. So we rely on each other a lot. But also, we have our personal issues of our family. I'm a mother of 2 kids. I also do other dance on the side and am doing all this, trying to balance all out. Like I said, it's you try to just put all these emotions in, and I come home and I try not to share like the hard day I have because I have to put up a smile and be a mom now. And then I do the business mode and I do Filipino folk dancing and I'm the executive director and, try to do that as well. I think it's comes down to, really doing a lot of self-care during this pandemic and this time. And just being honest with yourself and giving yourself that moment to let that pressure cooker out and release some of that hurt, that grief, and anything that you're processing. I also recently have just gone through something kind of difficult with a couple of my patients. So, and I haven't had that in a while. And when you don't get to feel that and let that out and have those friends and colleagues to kind of bounce things off of you, that support system, it's hard. And so I think with the pandemic on top of it, the fact that we can't socialize, having to use this virtual space to call, text, and FaceTime each other, it's just so different than going out and receiving that hug from that colleague and letting those tears out and just letting you vent. Anyhow, that's a little bit of kind of what I can share. I think in general, with my own personal thing, I think just trying to remember to take care of one another. And, it's really appreciative that so many people are saying how an awesome job nurses are doing and anybody in the healthcare, because yes, it is a hard job. At the same time, I continue to do it every day because I know I'm blessed. I love what I do. I love that I'm blessed to have this career. And I have really supportive friends and family. I can't wait for this pandemic to be over. And actually, now that most of us have our COVID vaccines, many more of our nursing colleagues are able to kind of get together, which is great. So there's that light in the tunnel that I kind of am looking forward to. But yeah, it's just been a difficult and challenging time. And I don't know, I feel like I'm doing a lot more talking, but if you guys have any specific questions about that, I'd love to bounce things off of you, but I think that's what I can share.
Thank you, Ritchel. Yeah, I think you mentioned, the ways that you practice self-care. I think we're going to have some opportunity for you to elaborate on that for sure in a little bit of a later part of the discussion. So Han Han, I want to invite you, maybe if you can share maybe some insight on your experience being part of the emergency response intubation team, or anything related to that, or anything you care to share at this point.
Yeah, so in Canada, when the first wave of COVID-19 hit Ontario, our hospital is kind of proactive. So we reduced the number of ORs during the day so that we don't overload the ICUs, because most of the patients that comes to our hospital, it's one of the major hospitals in Toronto, would go to the ICU. We get the worst cases pretty much. And so this emergency response intubation team was formed in response to the pandemic. So it's composed of nurses, anesthesia assistants, respiratory therapists, and anesthesiologists. So basically, we go into the different parts of the hospital, whether it's the ICU, emergency, or wherever, to do the intubation part. Because if there is anyone in the hospital who is very particular with PPE and cleanliness and and intubation per se, it would be the operating room nurses, because that's what we do every day. Like that's what we intubate patients every day, and we wear PPE every day as a scrub nurse and as a circulating nurse. And so it's also different. The team is different from Code Blue team. So there's a Code Blue team, and then there's the ERIT team. The Code Blue team is for cardiac arrest, and the ERIT team is just for Code Deltas. We respond to Code Delta, which is best for intubation. And we've had intubations in the emergency room, in the ICU, and also on the floor. And I've had patient that died on us, and we just couldn't save him. And I've actually seen one worst case as well, where a COVID patient had to put into ECMO, which is an extracorporeal, which is an artificial lung for the patient. The cannulas are inserted to the heart and lung to sort of like, it's like the last resort for the patients, because the worst cases, they will have multi-organ dysfunction. So I've seen those things, and you know what? In Toronto, I'm actually pretty blessed, and I would say the kind of support I get from not just from my family, but also from my arts community, the Filipino Canadian arts community, and the whole Canadian community as well. During the pandemic, when I was part of the ERIT team, I actually volunteered, because they're asking for volunteers, and there was only like a few of us who volunteered in the team, because it was still a very scary time. So much is unknown. There's not a lot of research about what COVID-19 is and stuff like that. So they were looking for volunteers, and I said, I'm just going to volunteer. And my mom was actually really scared, because she has respiratory issues. And so I decided I'm just going to isolate myself. If I'm going to be part of this team, I'm going to isolate myself. So I stayed in a hotel, and luckily enough in Toronto, like the hotels were offering free accommodation for healthcare workers in the front line. So I stayed in a hotel alone for about 3 months, and then my sister and my mom would just cook food and then deliver it by the doorway, and I'll just get it from the doorway. And the hotel, yeah, you can say the hotel is fancy, but actually in the hotel there's no kitchen. It's closed. The hotel is closed. There's no one around, and the kitchen is closed as well. So I was eating a lot of noodles for the most part, and I have to bring my own rice cooker. So I was isolating for those 3 months. I was alone, and sometimes it kind of feels lonely. And Ritchel was right; like self-care is really important, and I try to be as I've gotten good at it. I guess because I've been doing this for a long time. I've gotten good at it, and I work in the OR, which is a high intensity environment, and I also do cardiac surgery, which is really highly intense. But I'm very lucky to have a community, especially, you know, what really got me through is the arts community that I have, because they always check up on me. Hannah, how are you doing? What do you need? And we got a lot of free stuff as well from different companies in Canada. Like they would send us food in the hospital, get free so many things, and free shoes, although I didn't get one, or free clothes. I also didn't get one. There was a lot of free food, but I thought, you know, that free food, you could have just given it to homeless people and stuff, because we're working and we have a job and other people are losing their jobs. So there's a lot of accolades for nurses and healthcare workers, and I'm grateful for it. But at the same time, honestly, we don't need it. Like the people who are homeless right now or don't have a job, those are the very people who needs it. And especially because I'm connected to the music community, the musicians, because they're losing their gigs, you know, the artists, the performers, you know, those are the ones that actually need help more than nurses. Yes, we're in the front line, but at the same time, we're just really doing our job. Yeah. And I feel like all these accolades are just, you know, fancy, superficial things. Because in the back of there's like political conversations about here in Ontario, the government passed a bill to limit the increase of wages to nurses to 9.98%. It's not even 1%. And then that's for nurses and teachers. And then for firefighters and policemen, they get like 2%. And in Canada, our healthcare is universal and it's public healthcare, and our hospitals are unionized. So our union actually, during the pandemic, the entire pandemic in 2020, nurses have been protesting about this bill. And even though there was a pandemic, nurses were going to the Queen's Park, which is where the government offices are, and we're protesting. Unfortunately, I wasn't able to go because I had to go to work. But you know, I'm in solidarity with all the nurses in our province, and we have a petition. And right now, we're filing a case against the government for why that unfair treatment of nurses versus firefighters and policemen. I'm not saying that they don't deserve it. I'm just saying that we have to be fair, because you know there's a slight sexism in it, because as you can, you know, it's obvious, nursing profession is a female oriented profession, and teachers is also female oriented profession, and firefighters and policemen, it's a really male dominated profession. And yeah, so we're going through that as well. And also at the same time, you know, there's more emphasis on the nurses, but there's not a lot of emphasis on PSWs. In Canada, we have PSWs, personal support workers, which are basically the caregivers, and they usually work in long-term care and residential homes and nursing homes. And in Canada, those are actually the areas which are actually hit by COVID. And I think there should be more emphasis on personal health care workers. And in Ontario as well, the most of the mortality from COVID among healthcare workers are from PSWs, not nurses, because they are directly in line and they're not really used to wearing PPE. And when wearing PPE, it's actually how you wear it and when you remove it that's really important, because there's a sequence. You can't bypass it, because the transmission of the virus is really critical at that moment when you take it out. And you know, PSWs and nurses working in those facilities are not really trained, nor are they used to wearing those things. So and other professions that are actually in the front line as well, like the respiratory therapist and the perfusionist who takes care of the ECMO if the patient has like ECMO. And during the pandemic pay, because our government of Ontario like gave us a pandemic pay, sort of like a reward or something. But like, and then yeah, the nurses are included, but they didn't include the perfusionists and the respiratory therapists, which are actually in the front line and directly you know, yeah, they're part of the intubation team, and I feel really bad for them. So we kind of also have to be in solidarity with other healthcare professionals as well, and not just nurses. And during the pandemic as well, like, but you know what, I'm really grateful too that some of them are actually watching this our dialogue right now, like my arts community, because we made a music video a socially distanced music video through Zoom and during the pandemic, and we posted it on YouTube. So, and it's to my song LDR, which is long distance relationship. So we were just celebrating our long distance relationships because our shows were canceled. So we just kind of culminated it in one music video. So, you know, you find joy in the little things, and yeah, that's how I got through it. And I started embroidery. So yeah.
Thank you, Han Han. It sounds like both you and Ritchel are kind of touching upon this sort of next part of the conversation. I want to maybe steer us to, you know, it sounds like Ritchel, you know, finding ways for, like I said earlier, you know, finding ways for self-care and, you know, being part of Parangal dance company, and Han Han, you continue to reference your artist community and how supportive they have been. And I think Elena Andres put in the chat, thank you for that, kind of pointing out how, you know, when the structure or the system might fail to support you all in ways that you actually need, community shows up, right, to support, right, and you kind of figure out different ways of both care and well-being and health, right? And so the next question, I want to actually bring Claire back on as well, and just ask you all to maybe to reflect and invite you all to reflect from your, you know, varied experiences, some of the ways you negotiate varying understandings of health and care, right? Just very simple and maybe both philosophical and practical, right? How do you negotiate those varying understandings of health and care within these contexts, right? The workplace, within your families, within your communities. Perhaps this is also informed by being part of the Filipino diaspora, right? And how that informs your practice or the sort of lives you lead, and the support you get outside of your practice, right? Outside of work, right? So how do you kind of understand health and care, right? And I think all of you will have some great insight from your unique perspectives. And since you're already on, Han Han, you can start, and then we'll bring Claire on.
So like I said in my introduction, I grew up in the Philippines. My values formation was from the Philippines, and I already have a strong hold of who I am, what I am, and where I came from. And when I migrated to Canada, when I met these Filipino Canadians born and raised in Canada, there's sort of like this cultural gap. Like they don't understand each other. Like I don't understand them at that time. Now I do. And you know, and in my education in nursing too is totally different, and it kind of relates to how we view our perspective in the Philippines. It's more of like a collective community, more like community and collective oriented. And when you come here in the West and in North America, the emphasis is more on the individualism. So my inner internal conflict was, how do I reconcile individualism to, you know, to what I've been taught? And you know, in the Catholic upbringing as well, we're always taught to love thy neighbor as you love yourself. It's never love yourself first before you love thy neighbor. And I would argue that you should love yourself first, then you can love your neighbor, because you can't really give what you don't have. And so my inner struggle is like, how to be Filipino within a Canadian society, and how to be a Canadian in a Filipino society as well. So, and my experiences as an immigrant and as a Filipino who was born and raised in the Philippines, as someone who has traveled and, you know, I decided to go back to the Philippines and travel from Batanes to Tawi-Tawi. And I was just kind of hopping around and immersing myself into the culture. And at that time, I released my album, and I donated the sales of my album to an indigenous school. And I wanted to do that, and I wanted to experience, because even though I was born and raised in the Philippines, there's so much that I don't know about the Philippines, you know, like so much. And if you go to one island to another island, it's totally different, like totally different. And I consciously decided that before I go somewhere else in the world, I want to go to my own country and discover it for myself. So I traveled all over after I volunteered in Project Leyte. And, you know, those experiences actually makes you a better nurse, because the world is becoming a global global citizens of the world. And the diaspora, the nursing diaspora, is not just North America. It's like the UK, Australia. I've been to Australia. Their stories are different too. And I have friends in the UK. Their stories are different too. And then in the Middle East, New Zealand. And interestingly enough, when I graduated nursing in the Philippines in 2006, there was a cheating scandal. And then the US said that they won't accept our batch because of the cheating scandal, because they question our credibility. And so there was a protest, and the cheating scandal was in Manila, and I'm from the South, I'm from Cebu. So they want everybody to retake the exam. And we were protesting that we were not going to retake the exam because A, it will cost us money to do the reviews. It will cost us money to apply for the licensure again. And, you know, in Filipinos don't have that much luxury of money to pay for those things, because Filipinos take their education seriously. Like an education there in the Philippines, if you're in college, if you're in nursing, you can't possibly go to work actually, because it's like full time. It's like a full-time job. So it just makes you realize, you know, the influence of the US to Canada, to the Philippines, like the influence of them, like how dare they say they won't accept us because of the cheating scandal or whatever. And actually we filed a case and it reaches the Supreme Court, and that was actually my first taste of protest. Like we were in the streets, we were doing vigils, we were doing in the media. That was my first taste of protest, like how unfair it is. So most of our batch, you know, like, okay, fuck the US, we'll go somewhere else. So everyone else is kind of like scattered all over. That's why I have so many friends in the UK, New Zealand, and everything. And although some of them also went to the US. And, you know, it's well, here in Canada, as an immigrant, you're always considered as the other, but I never felt that it was a disadvantage on my end. Like when I first came here, very sadly enough, the first person who discriminated me or made derogatory remarks to me were not non-Filipinos. It was a Filipino, and she called me a fob, like fresh off the boat. And at that time, I was so innocent, I didn't even know what that means. So I just kind of shrug it off. But then I told a friend of mine, and she's like, "What? Did she call you that? What? And you didn't say anything, blah, blah, blah." So I got curious. And that's why I was in school at that time. I was working in fashion retail, and I didn't know anything about fashion. And then I was calling everybody mom, sir. That's like the Philippines. But then I was like, no, you just call me by my first name. And I felt so weird about it because that's not how we do it in the Philippines, right? And I also work at Jollibee, and when I was 17, I worked at Jollibee, and you're always like, "Hello, mom, sir, welcome to Jollibee." And I thought that when you come here in North America, you also like call your managers and your mom, sir, but no, it wasn't like that. So there's a lot of like culture shock for me, and I was only 21 at that time. And so when somebody called me a fob, and I was so surprised, okay, oh, it was derogatory. I didn't felt it because I didn't understand it. So I got curious about it, and why is this that Filipino Canadians and Filipino born and raised in the Philippines and Filipino Canadians born and raised in Canada don't get along? So that's when I started volunteering. That's when I started doing community organizing stuff. And that's when I started my art. I became an artist. When I became an immigrant, then I became an artist, because I felt like you shouldn't compromise who you are to be accepted and to conform to the bigger society. I think being an immigrant, you're considered an other, and being an other is actually power. And that's why I write my songs in Filipino languages. And because I don't really care. Like I was pressured to write in English, but I'm like, no, this is what I wanted to do. And I'm grateful that I have Filipino Canadian artists who, you know, ride along with what my agenda is, pretty much. And most of the people I work with are Filipino Canadians born and raised in Canada. And I just wanted to sort of like be an example that we don't need to be like, you know, if we all come together, we can make beautiful work, beautiful music, beautiful art. And art to me, music is therapy. And when I'm when I'm being myself, then I'm also encouraging others to be themselves. And that to me is the essence of nursing too, right? Like the core of nursing is social justice. That is the core of nursing. And nursing is about caring and the environment, about like, it's about caring per se, but it's bigger than that. And to me, art is therapy for myself and for other people. And when I'm doing music or when I'm practicing nursing, I am actually practicing nursing in every aspect of my life. And yeah, I think I'm already talking too much. I'm gonna give Ritchel and Claire the floor to share their experiences as well. Sorry, that took a long time.
No, don't apologize. That's great. You said so much, and I think that the part that I'm kind of gravitating towards is this notion of the collective and the individual, right? Which shows up in a lot of how you talk about who is supporting you, right? It's community, it's collective, right? And that's a fundamentally different way of living in the world, right? Than what gets prioritized in the West, right? Which is individualism, right? And so everything is built out of individualism. And so there's no room for that, like that kind of community collective justice. But Han Han, I'm going to actually invite Claire on. But we'll bring you back again for the next. But thank you for sharing all of that. I think it's super wonderful for all of us to hear. But Claire, if you want to come on and maybe talk a little bit of your negotiations with health and care and individual, collective, all the stuff that we're so fortunate enough to hear today from you all.
I negotiate contradictions and lies and just performative everything, especially this year. And when I think about in nursing, there's so many heroes and sheroes, right? Like Florence Nightingale, Lillian Wald, and others. And being a nurse and knowing that people are continuing to praise folks who were central to colonization and to the creation of a labor export policy in the Philippines in particular, it just it makes me think like we need to really decolonize so much. So I'm thankful for spaces like Nursing Clio, really great work that they're doing, badass feminist work. But I navigate contradictions also in these ideas of, Han Han just said social justice is a core value, right, of nursing. And we say that all the time. Han Han, you're living it. I love hearing that. When we look at our foundational documents, like our scope and standards of practice, our code of ethics, it's there. But also those documents are super colorblind racist. They don't name racism. They don't name how widespread, misogyny and transphobia is in nursing schools, in all settings in nursing. It's so widespread. So you'll have deans who will say, well, you want to put together an elective course about trans health. No, that's not nursing. Or, you're applying for a grant to look at the experiences of Filipinx nurses. No, we're not going to fund that. So much of nursing is shaped by this individualistic, oppressive, hierarchical lens. So I'm super thankful for nurses and students and comrades, including folks who are on this call, for the work. And something else I want to say really quick about care is I think about the care that Kasamas and Gabriela Oakland have, right? When we're suffering, when we're hearing about things like what happened in Atlanta, or hearing about more attacks and red tagging in the Philippines, or we're knowing that we're experiencing stress, we have a lot on our plate because we're fighting all of this all the time. We reach out and we care about each other, where it's not a competition, right? It's not about individuals, it's about what we're doing together and how we're caring for each other, including how can we nourish ourselves with good ass Filipino food. So there's a lot there. Yeah.
Thank you, Claire. Now I'm super hungry. Ritchel, if you have, I know you started talking about care a little bit earlier. If you want to elaborate or share some thoughts, maybe in the context or in reaction to.
Yeah. First of all, Han Han, I think every time you speak, I totally connect with you, and Claire as well. Everything you guys say, just like I get excited. I want to like unmute myself and talk to you. I wish we could have another like session where we can just kind of talk in general. But anyhow, from my point of view, I think how it has kind of turned me to the way who I am is that I came here when I was young. So kind of in the opposition of Han Han, I came when I was 6. And so I was kind of told, or it was kind of pushed upon me, I need to be Americanized. I need to forget my where I came from, kind of a thing. I need to forget, or not forget, but just like I was kind of told more like you need to learn English and you should, not have that accent. Maybe it was more on me, but environmentally, that's how I felt pressured, as far as like, oh, well, you came here, you need to be Americanized. So I kind of grew up that way, which in turn I lost my accent. I felt like I've lost my language, my Filipino language. I then also didn't even know about my Filipino culture, and only until when I was in high school and middle school, really, when I got told from my sister about Filipino folk dancing, that brought me like, oh, okay. And then my parents finally sent me to the Philippines for about 2 months in the summer with my sister, and that was kind of where I relearned my culture again. And I kind of was like, well, I'm not going to forget who I am. And that's when I went through my self-identity and kind of looking for that. And ever since then, I've been looking for it, continuing to keep it with me. And that's kind of why I think I got really connected with dancing and with the dance companies and community I'm with right now. It's what keeps me to remember who I am. And just like what Hanan said, I go back to the Philippines multiple times, and it doesn't matter what island, there's still not enough time, and there's so many places to still see. And I still want to continue to go back there to learn more. And even the fact that I didn't even know that how many indigenous groups there were in the Philippines. And the fact that when we started researching more about those groups, it's just crazy how like the lack of knowledge that we have, and even normal Filipino Americans right now, they just don't know. So I think it's really great to have that background and still know that, and then take that in. So it's in regards to nursing, the way I kind of take that and push that to where I work with my patients is that, with that kind of background, whether it is the Filipinos, patients that I take care of, and some of them I do, they're like, oh, you're helpful, isn't that? But it's nice to come with that understanding of where they came from, the respect their culture, and it could be for any culture. So if you can't respect your own culture and know where you come from, it's hard to respect that back among to someone else, So I think that's where it's really important as far as forming me and who I am as a nurse. So.
Thank you, Ritchel. I think that this project that Alleluia is kind of initiating with this conversation really is part of that same trajectory, right? It's part of that same invitation for folks to think about themselves, to think about their ancestors, and to think about their kind of daily struggles, and to really spotlight and highlight those stories. So I want to thank you all for gracing us with your stories and your experiences. I want to tell everybody, I don't think we'll have an opportunity for Q&A, but hopefully what this turns into is opportunities for further dialogue. As Claire was saying earlier, it's a really, really important political move to host conversations, right? And so I think that if this turns into something online or some other way where we can have these dialogues, we'll definitely do that. But I wanted to actually wrap up today's conversation knowing that it's 6:53 Pacific Standard Time. And so we're trying to end at 7, but I want to ask this last question, and I want to bring Kathy and David back on as well, and maybe have you start off in response to the question. And so as we know, and as we've seen, Cool Arts is doing some really wonderful work here and attending to these stories and just giving space and holding space for these really important reflections. The Bulosan Center for Filipino Studies, who I'm also working with, is in a different way pursuing research around public health, contemporary labor struggles, and community need. There's transnational and local grassroots organizations staying close to the ground and fighting for our workers, whether it's for wages, whether it's for other sorts of support, and things like that, fighting for our communities. And so I want to ask, from your unique perspectives as educators, as scholars, as practitioners, as artists, as activists, as organizers, if you can share with the audience, what do you believe our broader communities can be doing to continue to build solidarity with Filipino nurses and healthcare workers, right? So just based on kind of what you see and your activity now, and kind of where you've come in been here in support of Filipino nurses, and kind of how can we continue to build solidarity with these nurses. And I'll invite Kathy or David to start us off, and then hopefully we'll get to hear a little bit from everybody.
Yeah, I can start off, and I'll just keep it really brief because we're so close to 7. I think that reading about the history of Filipino nurses and other Filipino migrants is really key, and listening to contemporary stories as well. And I think one can do that through, I noticed on chat that Jane Hopkins posted the link for the Beyond Florence, as in Beyond Florence Nightingale essay series in the collective blog Nursing Clio, is a great way to learn about some Filipino American nursing history. I wrote a short essay for it about the history of Filipino immigrant nurse activism in the United States, but it's also alongside essays about Black American nurses and Native American nurses, and inadequate PPE actually for nurses in US nursing history. And that would be a great place to begin.
For myself, I think that nurses, and again, I want to emphasize that Filipino nurses are majority in most of the urban areas, urban cities, especially on the West Coast. And they play a pretty big and major role in decisions and influencing. But I think nurses want, the single thing that they want the most is Medicare for all for the United States. There's 3.5 people dying every hour. So during our presentation, 7 people die because they have no health care right now in the United States while our program is going on. And the majority of them are people of color, and they're poor people, the majority, overwhelming. So by getting Medicare for all, we'll be able to save maybe, 20,000 lives a year or more. And I think that's the wishes of the nurses, my wish, and many other people. And I think that, in the world, in America, we don't deserve to be 37th in the world. Many other countries are much better. And so many people die because they have no health insurance. And in Canada, you don't have that. Canada, people get care when they want to get care, when they need it. And just right below you, there's a barbaric country that doesn't do that, one of the few countries. So I would want the barbarism to stop, and for that to be one of the basic things for less people to die.
Thank you, David. Thank you, Kathy. Out of the 3 of you, whoever wants to go, Han Han, Ritchel, or Claire.
I'll just do like a 1-2 quick sentence just to share. I think what we can do is just really support the union for those nurses. And, a lot of nurses really do come together. And I think the other thing I can say is, really just advocate for your family. That's what you can do. Because we love to try to make sure we treat every patient, at least I do, that we treat them like family. I would want the best for that mother, father, aunt, uncle that I'm taking care of. So advocate for your family, advocate for each other. And that would be my recommendation.
Nursing students in here, we need you. And you don't need to wait until you're licensed to make this all different with us, right? So email me. We'll keep doing the work together. I would say join us in our orgs. Be in solidarity with orgs led by workers, by Black, Latinx, queer, transgender, non-conforming folks, right? We're stronger together. I also ask folks to take a look at the Philippine Human Rights Act, right? We're in the belly of the beast here in North America, and fight for ethnic studies.
So what I will say is just to show up. Okay, show up for yourself and show up for your community. And we always ask for representation from, we always fight for representation. So I encourage everyone who's in this, who's participating in this dialogue to just show up. Like the way you show up for yourself is, you take care of yourself, you take care of your family, you love yourself, the good, bad, and the ugly. and you accept your history, including your nursing history and migration, that's part of loving yourself, and that's part of accepting yourself, and that's just showing up for yourself, and to be patient with yourself as well, and follow the guidelines with COVID-19. Wear your mask, wash your hands, socially distance, because you're actually helping healthcare workers with that, because you're not overloading our workload in the hospital. Because like in Canada right now, yes, we have universal healthcare, but our backlog of surgeries is actually the list is pretty long, and we'll be tackling it for the next 2 to 3 years. So even when this pandemic will end, the nurses' work is never ends, and it's actually getting worse and worse, because a lot of the patients that were canceled this last year are now, their health is getting worse. So a nurse's work never ends. So just think about that after this pandemic, we still have to face a lot of things. And the second one is to show up for your community, and like what all the other panelists are saying here, like, be active in your community and be aware of what the social issues are in your community, not just nursing, but the whole migrant community, the whole Filipino Canadian, Filipino American, Filipino British, Filipino Australian community, the Filipino diaspora, because it's not just limited to North America. And to advocate for your rights, and to nurses as well. Like, one thing that frustrates me about my coworkers, because you mentioned it, that sometimes we get the worst jobs or whatever. Like, I think it's our Filipino culture, because the Catholic guilt, like, we're all say yes to everything because we're so nice, and we're so nice that it's actually a disservice to us that to say no is also an answer, and no is actually self-care, and no is actually saying no is an act of showing up for yourself as well. So that's my that's my advice for all my nurses. And it frustrates me because I have one experience when I have a pregnant coworker, and she's Filipino, and we were doing an orthopedic surgery, and then the manager sent her to that room where we use x-ray, and if you're pregnant, you're not allowed to go there. And so she went there with her lead. She's 6 months pregnant. And then I stopped her in the room. What are you doing here? And she's like, oh, I was told to come here. I'm like, no, go back. I'm not going to let you in. Tell him to give you to another room where there's no x-ray. So, like, you need to speak up. And I've experienced harassment in my work from non-Filipinos, but I don't know, maybe it's my upbringing. I'm very outspoken, and I always say no, and I've reported people to HR. I'm a troublemaker, I would say. But it's a good thing. Being a troublemaker is a good thing. And yeah, that's how I will end up my message to everybody for saying the room.
That's it, Hannah. Being a troublemaker, I would add anti-imperialist, anti-colonial troublemaker is a good thing. And so I want to thank Ritchel, Han Han, Claire, Kathy, and David for showing up for us. I think that I might say for all of the community folks here, both related and not related to the nursing community and profession, we hope to do better in showing up for you as well, and just being in solidarity with you all. So I want to thank you deeply for sharing. I think what it, we're over time by 3 minutes. What it shows to me is that we need more spaces for these stories. We need to hear from you more. And, I'm interested in collaborating. I know someone from NAFCON put in the chat, we need more collaborations. And so I'm really excited that Alleluia and Cool Arts had brought us on just to have this humble little conversation on a Wednesday night. So I'm going to pass it back to Alleluia, who will close us out. And again, I want to thank everybody for tuning in and sticking around and hearing everybody.
Thank you. Deep salamat to our moderator, Jason, our amazing panelists, Catherine, Claire, David, Han Han, Ritchel, salamat talaga. Thank you everyone for joining tonight's Nurses in the Diaspora panel. Follow the making of Nursing These Wounds by visiting our website, coolartssf.org, and signing up to receive a weekly newsletter. This event was brought to you by Cool Arts and the following community organizations. We got to do this, Bulasan Center of Filipino Studies at UC Davis, Filipino American Development Foundation, and Yerba Buena Arts and Events, and was funded by the Hewlett Foundation and San Francisco Arts Commission. Join our next panel next month, Wednesday, April 28th, 5 to 6:30 Pacific. We might have to make it to 7, and 8 to 9:30 Eastern. Nurse Narratives in the Arts, moderated by Dr. Joyce Liu, Associate Professor and Chair of Theater and Dance at Pomona College. We will be sending you a Nursing These Wounds survey. That's another way to help us inform our project. We look forward to reading your responses. Again, thank you so much, and good night.
Thank you.